And that's it, 1 minute passed. So hi, everyone. My name is Leighton Helen Williams. I'm a workplace engagement manager here at the Black Dog Institute. And thank you so much for joining me today for this really important webinar called Promoting Wellbeing and Help Seeking Resources at Work. So why does this webinar exist? This webinar is about addressing the gap that still exists for so many workplaces where we are seeing a huge increase around mental health awareness. We see a huge increase in some great messaging about seeking mental health support early and often, but there still is a gap around the actual understanding of the help-seeking process. Sometimes when we talk about mental health help seeking, it can be a little oversimplified. Sometimes it can be a bit glazed over, and it can kind of make it appear to seem like it's an extremely easy process. And because of that, I think it's actually important to slow down, and particularly on days like Are You Okay Day, reflect on how do we effectively talk about help seeking at work? Are we giving helpful enough information? And how can we make that pathway to support as easy as possible? A couple of quick notes for today's webinar. So I, Leighton, will be leading your webinar. My colleague, Mary Lou, is in the background here, who may be responding to any of your questions in the chat box as they come up. So she'll be there to support with that. I also just want to quickly give a content warning. So as you can probably imagine, we are going to be talking about mental health and help seeking today. The help seeking aspect does include how we can get support if we are having thoughts around suicide. And something that I think is important to mention is if this webinar is not the right content for you today, that's okay. Anybody who's registered for this webinar is going to receive a recording, so you can listen to it at a time that works for you. You can also take a break or step out at any point if that's the right decision for you. But what I hope we'll accomplish in this session together today is that the talking about help seeking feels a lot easier when we have better information to do so. So before we go any further, I want to quickly acknowledge the country in which we are all meeting on today. So I'd like to acknowledge the Aboriginal and Torres Strait Islander peoples as the first inhabitants of this nation and the traditional custodians of the land on which we meet and work. I'm coming to you from the land of Darwal people and Wollongong. And we recognize their continuing connection to land, water, and community, and pay our respects to all Aboriginal and Torres Strait Islanders elders, past, present, and emerging from all nations across this country. And I recognize any Aboriginal or Torres Strait Islander people attending the session today. If in the chat box you'd like to recognize the land in which you're coming from, we'd love to hear that as well. So I imagine since you're here at this webinar, you might know a little bit about the Black Dog Institute, but just in case you don't, we are a mental health research institute, and our aim is better mental health for everyone. That means better resources, better education, better treatments, and we also are hoping for a safer community. And because workplaces are a huge part of community, we spend a lot of time together. That gives us a really amazing opportunity to notice behavior changes in each other and to know about each other's lives and what we might be going through, and to have the opportunity to support each other and normalize help seeking when it makes sense. So what are our goals for this webinar today? I want you to leave this session feeling more confident and seeking mental health support for yourself. And I also hope that you leave this webinar feeling more confident helping others seek support by talking about help-seeking pathways with more information. Part of what we're looking to do as well is not just be able to list off help-seeking pathways. We want to paint a picture of what it is like to reach out to these services, what to expect when you reach out to these services, and really importantly, talk about common barriers to support, acknowledge those things, kinds of challenges that we might encounter as we're seeking mental health support, so we can address those and encourage and support people around their help seeking if and when they encounter those issues. So at the Black Dog Institute, we know that 1 in 5 of us in any given year is going to experience mental illness, and 60% of those people aren't going to seek any support at all. And I'd like for you to start thinking about what are the reasons people might not seek support? What are common barriers to support? If we can be cognizant of those barriers as we're supporting each other or even ourselves, we'll hopefully be able to acknowledge, validate, and maybe possibly come up with a solution around those barriers. Some common barriers that you might be familiar with are going to be a lack of awareness. So, meaning a lack of awareness of what supports are available. There can also be a lack of the ability to access language to talk about mental health or our need for support. So keep in mind that everyone on this webinar, and there are a lot of us, all grew up with a different understanding around mental health and well-being, with a different level of comfort with that subject, or a different access to the language and terminology that we might use. So not being able to actually understand what's going on can be a big challenge. Another common barrier to support is money. So all of us are quite acutely aware of the rising cost of living at the moment, and some mental health support pathways can be costly. So we know that's a huge barrier. So in this session today, we'll talk about free or low cost services that can support us. Another barrier to support to be listening out for is people saying, I don't have the time, or maybe the energy to seek support. So for some people, that limitation of time or energy can actually result in increased feelings of stress around seeking support. So it's important to be mindful of those things. And then there's a very important word that we probably talk quite a lot about when we talk about mental health at work. It's the S word, stigma. But there's two types of stigma that I think are important for us to really reflect on today. The first one, the one that we're most familiar with, is social stigma. So how do others feel about me seeking support, and how do I feel about others seeking support? I've been working in workplace mental health in Australia for the past 13 years, even though it might not sound like it. I am a citizen and live here, but I've seen huge shifts in the dial of comfort around social stigma improving in many communities, not all, but many. A lot of us are actually actively trying to play a role in others seeking the support that they deserve, which is brilliant. It's part of the reason we're here today. But there's another form of stigma that is so acutely important, which is self-stigma. How do I feel about seeking support? How do I feel about needing support for myself right now? And for a lot of us, illnesses like anxiety and depression, but also experiences of grief, loss, overwhelm, really over-the-top stress, lots of change, they can actually change the way that we interpret the world. They change the way we talk to ourselves. They change our beliefs about ourselves, and they can really alter our relationship with hope. And because of that, this is why we can be such a valuable asset to each other. We can be a mirror to each other. We can help each other see the forest from the trees when we ourselves are in those moments, because no matter your level of mental health literacy, if you're going through a really tough time, it might really be difficult for us to understand that the services that are available can help us. So that is what we're hoping to take into the world after this webinar today. And this is the shared belief I'd really appreciate everybody to take with them in their conversations about mental health going forward, particularly at work, that seeking mental health support is simply practical, it's resourceful, and it demonstrates self-compassion. And these are qualities that we love to see in our colleagues and our loved ones. When we're at work, if we are tackling a new project or something new that we've never dealt with before for the first time, we actually look at it as a very good quality for someone to go to an expert that has experience with this thing that we're navigating, to learn different strategies and tools to navigate managing this new challenge, and then to go and apply them. Counseling support and mental health support is exactly the same. When we are actually experiencing challenges with our well-being, one of the hardest parts about it is that we are navigating something we've never navigated before. We just might not have the tools to look after ourselves properly because this is new, or this is a new level of support that we're needing for the first time. So I want this sentiment to be acknowledged, and also that it is okay to not be okay. And not just that, it is expected to not be okay many times in life. We will all tip over from time to time. And we want to increase the number of us that are seeking support when it simply makes sense. And when it makes sense to reach out for support is not just when we're experiencing mental ill health, but it's also when we would benefit from it. So life events, parenting, supporting aging parents, feeling like our work-life balance has gotten completely out of whack. If we're needing support because we're actually building new positive habits, but we need to be held accountable. There are many practical reasons and even preventative reasons to reach out for support. So let's keep this in mind, particularly if we hear people say things like, oh, it's not bad enough to need counseling. We want people to be starting to make that association between their physical and mental health. How long would we leave a physical injury, illness, discomfort before we'd have somebody take a look? So let's keep that in mind. So let's talk about what we're going to explore in this webinar today. There are 3 areas that we're going to talk through. The first part is individualized support. So what I mean by that is when we are actually seeking support from a clinician, from a psychologist, psychiatrist, social worker, counselor, we are actually getting one-on-one support based on our unique needs. We will spend the vast majority of today's webinar in this space because that's where we'll actually get a lot of our key messages that we will hone in on and feel comfortable sharing with others when we're guiding them to get the support that they deserve. So there's a lot of misunderstandings around counseling and mental health support. So we'll talk about that. When we're talking about individualized support, we're going to start with employee assistance programs because many organizations have them. But for organizations that don't have them, we're also going to talk about mental health care plans available from our GPs. And we're also going to talk about same-day support options. So when am I using hotlines versus EAP versus a mental health care plan? The next area that we're going to talk about are online resources available from us, the Black Dog Institute. So we'll unpack those resources that we can tap into on demand when we want to. And then we're also going to talk about self-care planning at the end of the session. This is something any of us can engage in at any stage. And you don't need to be a clinician to talk about self-care in the workplace. So hopefully this will be really, really practical and easy to implement. So let's talk about our first resource that we're going to unpack. So I firstly want to acknowledge we have hundreds of people attending today's session, all from different organizations. So we're going to talk about employee assistance programs on this slide, but much of the content on this slide is also about counseling full stop. So even if your organization doesn't have an EAP, there's going to be some really helpful information for you to absorb here. So firstly, employee assistance programs, EAPs. On the left side of our screen, we're going to look at all of the beneficial things that we want to make sure to include when we talk about EAPs at work. And on the right side, we're going to talk about some really important nuanced information about EAPs and just counseling support in general. So EAPs are completely free. So this is particularly important when we talk about the barrier of support being financial. So a lot of us are facing financial stress, and we don't want that stopping us from getting the counseling support that we deserve. A lot of people actually misunderstand EAP as being kind of a lesser service than what our GPs might refer us to. And that's really not the case. These are psychologists and social workers, usually with a minimum 6 years post-grad experience. And many of those EAP clinicians have their own private practices. So they're receiving GP referrals and EAP referrals as well. So it's the same level of clinical expertise that we're generally getting. It's completely confidential. So even though your workplace provides this service to many of your workplaces, they do not know if you have used the service or what you've used it for unless you actually disclose that information to people around your workplace. I also want to quickly flag that if you work for an organization that does not have an EAP, if any of your immediate family members work for an organization with an EAP, you can access that service as well. So EAPs will allow people, normally immediate family member would be anyone within your household over 18 can self-service through an EAP service, or your partners as well. But when somebody's calling in to access this service, they would actually just say, I'm a immediate family member of an employee who works at ABC company, and I'd like to book in a service. They're not going to ask for your birth certificate. They're not going to go through that type of screening process. There is an honor system there because we also understand that family means different things to different people. Most EAPs are going to offer us between 3 and 6 counseling or coaching sessions a year. Some EAPs offer that many sessions per issue. Some EAPs offer 10 sessions. So if you want to be a good advocate within your organization, please familiarize yourself with what is available within your workplace and make sure that you're explaining that when you're talking to colleagues at work. There's also something really important to be cognizant of when we talk about EAPs, but also counseling at large. And it's the reality that there is a counseling and counselor and psychologist, psychiatrist shortage across Australia at the moment. There are not enough professionals to meet demand. And this is where EAPs can be particularly helpful because if we are open to receiving counseling through a modality like telephone or video counseling, then that opens up an entire pool of clinicians no matter our location. This is particularly relevant for those of you who are tuning in from remote and regional locations. So being open to being flexible around the modality in which you receive counseling can decrease the wait for you to receive the care that you deserve. So it opens up a huge network of professionals for us. On the right side of our screen, I want to talk about a few things to always include in our messaging around EAP, and many of these are relevant for just promoting somebody to seek counseling support, full stop, as well. But with EAPs, many organizations will promote this service through the phone number that they use. And this, unfortunately, for some people, makes them think it's a hotline. So they can actually think that it's a lesser level of service than it truly is. But EAPs promote a phone number commonly because that is their booking center. So that is actually not a hotline where you speak with a counselor straight away, but it is actually where you call in and you just need to have your calendar in front of you because you're going to make your appointment booking there. So one, we want to make sure people know it's not a hotline because we don't want people to be disappointed that they're not receiving counseling the moment that they call in. That's really important. And then the second piece is we want people to know to have their calendars in front of them so they're ready to book an appointment at a time that works with them. With EAPs, you can see or talk to the same person throughout your entire counseling experience. This is really important to note for those people who also think it's a hotline and that they'll talk to somebody different every time they call in. With EAPs, the average use of counseling sits around 3 sessions. For mental health care plans, the average number of counseling sessions used usually stands around 4 sessions. So a lot of us actually think that we're going to need more sessions than we actually end up using. And a lot of reason for this might be a lot of us spend a lot of time ruminating and stressing and worrying about something that is really important, but we're not actually dedicating time to focusing on that issue. It's kind of just brewing in the back of our mind. So a lot of us can achieve a lot in fewer sessions than we realize. Now, this is a very important detail for any of you that are talking to anyone about seeking counseling support, whether it's an EAP or whether it's any type of mental health care professional. But interpersonal fit is essential. And the first person that we see might not be the right fit for us. And that simply might be because we don't connect with them. We might not like their general approach. And our clinical outcomes are directly related to the level of rapport and comfort that we feel with the clinician that we're seeing. So it is absolutely worth your time and energy to find the right fit for you. But it's important to validate that that does require energy and can be disappointing if the first person that we see isn't the right fit. So on Are You Okay Day today, let's say we are encouraging people to reach out for counseling support, and the first person that they saw, or even the first 2 people they saw, were not the right fit for them. Be solutions focused on behalf of the vulnerable person you're supporting. Remind them that there are hundreds of counselors available for them to seek support from, and that it is tough to have to find the right person for you, but you will have a better outcome when you find them. I also want to flag it's important for us to also speak up if we're in a counseling session and we're not liking an approach that's being introduced to us. We can actually say to the clinician, what you're telling me doesn't really resonate with me. Can we try something else? They will be so grateful for that feedback so they can pivot and keep designing and redesigning the support that they're giving you. So if you don't like the first person you see, call back into the booking center and try someone new. Another important message for counseling, full stop, not just EAP, also GP referrals and other counseling networks, is letting people know in your first appointment, we have to do a lot of the talking. Giving people this heads up sets them up for more success because they know what to expect in their session. And also, the first few sessions can be really difficult because we're talking about things that are hard for us to talk about. So, telling people to just be really mindful that those first few sessions, the weeks of those sessions, to be gentle with themselves, to up the level of self care that they're giving, to just be aware of the other pressures that they might be putting on themselves in their personal and professional lives so they can make adjustments. I mentioned before, being open to different modalities can really improve the waiting time for receiving the support that we're looking for. So if you are in remote and regional areas, please consider that. And then lastly, when it comes to services like EAP, the same day counseling supports that we'll talk about in a moment, or any other counseling supports, it's important to remember that counseling is for life management, not just crisis management. If you have been worried about the same thing for several weeks, if you and your partner have had the same fight several times and it's not getting anywhere, if you are feeling anxious and overwhelmed, not sleeping well, you're going through a breakup, a relationship breakdown, whatever it might be, any life event that would benefit from receiving support is absolutely worthwhile to tap into someone to get some support for yourself. So don't feel like you have to wait for something to get bad enough to tap into support. Let's also talk about another key way we can engage in one-on-one individualized support, and that's through a mental health care plan. Let's start out by talking about some of the reasons we might choose a mental health care plan over an EAP. So, of course, one would be if our organization doesn't have an EAP. It might also be because we have a great relationship with our GP. We have a health history that they're keenly aware of, and we really want them to refer us to somebody that they know and trust in our local area. A mental health care plan is also really important for those of us who have ongoing challenges to our mental health. So if we live with things like anxiety, depression, mood disorders, things that we are aware of that we routinely struggle with, just like any other ongoing health issue, like let's say we're managing diabetes or a heart condition, we need to have a healthcare plan in place. So that is what these services are for. And by being aware that we are actually likely to need this support means that we can be proactive and take the steps to have a mental health care plan put in place for ourselves before we feel like we acutely need it urgently. Let's go ahead and get the program in place. Mental health care plans are basically government subsidized clinician support, up to 10 sessions that we can access every year, where if we go to somebody who bulk bills, which I will flag, will have typically a really long wait time. So I think it's always important to be authentic about that, but typically will result in some sort of gap payment. So it's important to flag that, particularly if people have some financial stress going on. It's important to recognize that. So maybe EAP or the support lines that we'll talk about next might be helpful. But what happens is we refer into our GP and they're going to have a chat to us. We want to book in what's called either a mental health appointment, or some GP offices just call them longer appointments. It gives us 40 minutes with our GP. They'll often give us assessments to look at different things that might be causing the impact to our mental health and well-being. They might talk us through all sorts of different options based on our health history and what's going on. That might include things like medication. It might include other digital tools and resources they want you to try out. It might include other therapies that they might want you to consider. But they'll typically give us the names and contact details of anywhere from maybe 1 to 4 different professionals in our areas. And then when we leave their offices, we will call and leave a voicemail for each of those practices. They will call us back and let us know when their next appointment is. I think it's important to actually talk through those steps because Let's say we're supporting somebody who's finding daily tasks really overwhelming and stressful. This is a bit of admin. So it's important to just note that there's a bit of work required from us to get a mental health care plan. But once we've booked in that first appointment, then the process will be relatively seamless after that. But there is a check-in point that's built into a mental health care plan at the sixth appointment, where we go back into our GP. That's them checking in to say, are you benefiting from the therapist that you're seeing? Do we need to review any other aspects of the health support that we're giving you? It's just making sure that we have that more holistic support coming from our GP, who is our physical health expert, and that they are actually linked into the support that we're getting from the mental health support expert that we're getting as well. So we're combining their shared knowledge in our treatment. I think it's also important to flag that this is referral based. So there is a step between us getting the next form of support. If the person that we're supporting or trying to help them get to the next right place really does not have the time, energy for any sort of admin, an EAP might be a great option because we refer ourselves. There is no referral needed from anyone else. And then what we'll talk about in the next slide are same-day support options. So we'll go into that next, but basically with a mental health care plan, just be aware that there's a bit of admin from us from the beginning. It's an excellent resource to include our GP in our help seeking and in our health management strategy. For those of us who have ongoing support needs around our mental health, let's not wait until we actually have acute needs. Let's go ahead and get a mental health care plan approved and those appointments scheduled so we're proactively looking after our mental health and well-being. And this is another great way for anybody who doesn't have access to something like an EAP to get ongoing support from an expert. But what if somebody that we're talking to wants support today? Any amount of admin, any amount of waiting just does not feel right. We're going to talk about a few different resources at different levels of intervention that can be helpful. The first one that I'll talk about is Beyond Blue. Beyond Blue is an excellent hotline that we can reach out to. We can also talk to them online via web chat, but this is a hotline where when we call in, we will speak with a clinical professional. Beyond Blue is there to support us if we are feeling acutely overwhelmed, distressed, dealing with mental health conditions, or maybe we also just need a bit more support to take the next step. So let's say you're attending this webinar, but 3 months from now, it feels a little bit overwhelming to decide what to do next to look after our mental health. Calling Beyond Blue puts us in touch with a professional that might help us talk about our unique circumstances and what steps and what resources might be appropriate for us. So it's unique and designed for us because they're talking about our own unique situation. If someone in your life has really unique help needs, then you can also talk through what their needs are with a clinician and get some expert guidance. So Beyond Blue is also there for us if we're just feeling overwhelmed and need to vent to an independent third party just to knock the edges off while we wait for that next appointment that maybe we've booked in advance. But if somebody is really feeling down, really overwhelmed, we have some really great services through Lifeline and the Suicide Callback Service. Lifeline can support us over the phone, via web chat, and also through text. So if somebody that you care about, or if you yourself would prefer to engage in conversation that way, it might feel more approachable. But Lifeline is there for us to talk about when we're really feeling like we are in exceptional need of support. The Suicide Callback Service is obviously there to support anyone who is experiencing thoughts of suicidality. But what a lot of people don't realize is that it also is there to support us if someone we love is having thoughts around suicide, which can be an incredibly overwhelming space to be in. And it can also support people who are bereaved of suicide. And there's something very, very special about the Suicide Callback Service, which is in the name. We call there, and with our consent, they will continue to reach back to us. So part of getting mental health support that makes it so tough is the onus is on us to make that call, and it's hard to make that call. This service recognizes that effort and will start making the effort back to you. So with your consent, they can keep checking in and making sure that you're traveling okay, because you will likely have ongoing support needs. So they're going to keep checking in and keep making sure that you're getting the support that you need and deserve. And of course, if anybody is at risk of harming themselves or someone else, you can always call 000. So we've gone through EAPs and how they might be able to support us through life management or dealing with mental health issues as a free and confidential option, whether our organization provides it or anyone in our immediate family works for an organization who provides an EAP. We've talked about mental health care plans and how they can support us with our GP's additional input, and how that can be particularly helpful for those of us who have ongoing mental health needs. And we've also talked through same-day support options, whether we want to just knock the edges off today, get some support from a clinician, almost as a mental health concierge to help us get to the next right place, and also how we can get support if our needs are quite urgent. So hopefully, your wheels are turning a little bit and you're thinking about how these services have maybe been promoted to you or communicated about within your workplace, and how we might be able to offer more insight, information, and make the process of help seeking a little bit less overwhelming, a little bit more informative, and help be that bridge to support and make the process of engaging in these things a little bit less mysterious with better expectations management. So when we encounter challenges, we're better set up to deal with them and set up for success. But now let's switch over into some of the supports that are available to us when we want to tap into and bolster our mental health and well-being through resources that require no intervention from someone else. And one of those very valuable resources is something that's been created by the Black Dog Institute called My Compass, which is a self-paced online program that basically, as soon as you create your own confidential account, you'll do an assessment where you'll find out what presenting issues you might benefit from support with. That could be stress, anxiety, sleep. It could be a whole host of things. But basically, this program will recommend different e-modules for you to complete to actually start learning therapeutic strategies that you can engage in yourself. So My Compass, after you do that self-assessment and they give you those modules to start completing, it's what we're recommending is about one module a week, which is about 10 to 15 minutes. And in our research, we found that people who engaged in this program for at least 7 weeks, so that's 7 modules, found that there was a huge impact and reduction of symptoms for even mild and moderate cases of depression and anxiety. It, of course, is also a great resource for people who just want to increase their own mental health skills and literacy around their own mental health and well-being. There's a really great tool embedded in My Compass as well, which is a mood tracker, which you would just take about 1 to 2 minutes a day to tap into, because over time, particularly if you engage in the program as we've designed it to engage for over 7 weeks, not only can you get feedback on how you're improving in your own mental health and well-being, but it also tracks your activities and the people that you're seeing over time. And what we hope will happen is that we start to make correlations between protective activities and relationships that might actually negatively impact our mental health, so we can actually be more prepared to look after ourselves proactively when we need to engage in either of those different types of behaviors or relationships. So My Compass is completely free. It's designed for any adult over 18 and is a publicly available resource. So anyone in your life can participate in this program. This is a good time that I should have said at the beginning. I'll remind people at the end as well, but all of these resources and links will be shared with you after this session along with the recording. So all of this will be coming to you, so you'll have it at your fingertips. One of the barriers to support that we talked about at the beginning of the session was a lack of awareness or self-awareness, and also that lack of language. Asking for help is really, really hard if you don't necessarily have the language to express what is going on for you. BDI has created a really comprehensive online self-assessment clinic where basically you can complete these online assessments for depression, anxiety, but also things like our relationships with food and substances, All of your results are confidential, but after you complete them, there'll be recommendations of different types of support that might be beneficial to you. And there's even an option to actually click to get a summary of your results. So for those of us who, let's say, we're going to make that GP appointment, but we know that that GP appointment is going to be really hard to navigate because we have a hard time talking about this. You can either print that summary, take a screenshot of that summary, and bring it into your appointment and let that start the conversation about your mental health support going forward. So these assessments are available on the Black Dog website, and the link for this will also be sent to you. BDI's website also has a huge resource library where you can look at anything from our research findings, the research that's currently in action, incredible fact sheets, and free public webinars that we put on, particularly for groups like parents and young people that are at no cost to you that you can tap into anytime. So if you haven't explored the BDI website, I highly recommend you take a look. We also have something called a workplace mental health toolkit, which is all about mental health within the context of the workplace, which is a unique environment, which is free for you to download and share with others as well. The last resource that we'll talk about today is BDI's self-care planning templates. There are free ones available on our website, but you'll also see in hot pink at the bottom there a link to a great website called the 5 Ways to Wellbeing, where you can get additional ideas on self-care. But let's quickly talk about what self-care is and what role it plays in our mental health and well-being. For a lot of people, self-care kind of summons images of, spa days and cucumbers on your eyelids and kind of fluffy images while those things are great, self-care can actually be a lot more simple than that, and actually can be incredibly important during periods of high stress or overwhelm in our lives. So self-care planning is tried and true advice from ourselves to ourselves with strategies, relationships, resources that we know work when we are feeling acutely overwhelmed or going through tough issues with our own mental health and well-being. Self-care is something that is best done when we're feeling okay, where we can actually have the clarity to reflect on who was that great counselor I saw through my EAP provider? Who was that counselor that my GP referred me to? Or who was that great GP that I talked to a couple of years ago when I was going through issues like this before? What are the simple activities that I know I can convince myself to engage in even on the crappiest day? So this is a really important note when it comes to self-care planning. A lot of adults, when we talk about self-care, shoot immediately off into goal setting. So they think, I want to improve my health, so I'm going to start running a 5K every day, even though I actually kind of hate running. If you hate running, running does not belong on your self-care plan. Your self-care plan should be simple things that lift your mood, that are easy to engage in, even on a hard day. They might be simple things like choosing to have your cup of coffee or tea in the morning outside in fresh air before you get straight into the workday. It might be taking your shoes off and putting your feet onto some kind of natural ground, sand or grass or whatever is available to you. It might be something as simple as reminding yourself that the last time you went through a period of really heightened stress and anxiety, that it was good to take a break off of social media for a month because it helped you manage things. You might actually even say, I know that when I'm feeling overwhelmed, it actually really helps to listen to music more or to watch less streaming services or whatever it is. All of our self-care plans will be different and unique to us. And they're worth reviewing and revising a couple of times a year because our needs are going to change and our resources are going to change. We talked about our resources that can be barriers to support, such as time and energy. So be mindful about shifts in those available resources so you know that you can tap into things that make sense for that period of time. So self-care templates will be sent to you after this webinar as well. So have a think about doing this even within your teams at work or even as an individual or with your loved ones at home. So what I'm hoping you're feeling now is a bit more confident and potentially seeking mental health support for yourself. You might be feeling a bit more confident in how you talk about help seeking when it comes to supporting others at work. I would love if you pop into the chat things that have resonated with you from today's session that you might include in some of your conversations when you're talking about help seeking at work. And I'm going to open up for live Q&A here in a moment. But I just want to flag to anyone that might be interested in tapping into BDI's workplace trainings and things that we have for leaders, for employees, where we actually talk about the different levels of responsibility that exist at the organizational team and individual level. You can reach out to our workplace engagement team. That's my team. And all of us are going to be happy to talk through your organization's unique needs if you want to engage in any type of group trainings and things like that. But what I'd love to know is we are a research institute, so we want to know your feedback on the information that we've covered today before we go into the live Q&A here in a second. My lovely colleague, Mary Lou, is going to pop this hyperlink into the chat. It will also be in the follow-up communication that you receive from us. Let us know what you found helpful from today's session. But now we get into my favorite part, where I'm going to stop sharing my screen, and I'd love to open it up for live Q&A. Please let me know your questions. I'm going to be looking at the chat now and doing my absolute best to answer as many as we can. We're here until 11:45. Because it's Are You OK Day, I'm not going to rush off. I'll answer quite a few here if we can. But if you do have to run off to your next engagement, I absolutely understand that. Mary Lou, did you happen to capture any questions that might be worth starting off?
None have come through at this point. Just sharing the eval link.
Thank you. Well, I actually have a good one that I got in a session I led yesterday. So just in case you are interested, organizations can book in a private session like this for their employees. But I got the question yesterday that was about, what if the person I'm trying to support, I know they need support, I can see it, but they just won't tap into the resources I'm communicating to them about? I think this is so important to reflect on, particularly on today, but honestly, any day. We can't make somebody engage in mental health support. And it can be incredibly challenging on us to love and care about somebody who deserves support, who is simply not getting it. And one of the best things we can do in that moment is to tap into support for ourselves. So locking in an appointment for your own well-being and managing your feelings and boundaries around that relationship is essential, but you might also be able to unpack the way that you've suggested support to this individual previously, and that clinician might actually have new ideas on how to present help seeking to this person in a way that you might not have considered yet. So just be aware that that's something that you can also do. Somebody asked a little bit about what types of topics that Black Dog covers in our trainings. I don't want this to become a training spiel, but I will quickly tell you that the way that Black Dog does our trainings is all about the workplace context, because we want it to be about having safe conversations at work within the context of work. So a lot of our trainings focuses on, let's say, team leaders. So team leaders understanding what their responsibilities are to support people after a disclosure, have an effective conversation, offer things like reasonable adjustments, support the return to work process, and things like that. At an individual level, we're talking about why we might choose to disclose, how to seek support for ourselves, how to have effective conversations peer-to-peer, and we unpack self-care as a much more deep dive activity. We have resilience courses, which do not solve organizational structural issues, but give us as individuals tools and resources to better look after ourselves. But that workplace at blackdog.org.au, Mary Lou, if you can actually type in our workplace email address in the chat as well, that's where we can unpack those programs in the context of your organization's needs. What would you recommend to someone who's tapped into these resources and they're still not coping or managing or improving over a longer period of time? One thing that you might do, well, one, we have talked about how it is around finding the right fit. And for some of those, I will actually speak from my own personal lived experience. It has taken me years to find the right professionals for my own mental health and well-being support. It can take years. So I firstly want to normalize that, particularly if our needs are quite unique, and that it's worthwhile to keep looking until you find that individual or group of individuals. The next thing might actually be asking for a potential referral into Black Dog's clinics. So Black Dog does have clinics that trial novel treatments for treatment-resistant depression and other mood disorders that you would need a referral into from your health professional. That could potentially be an option, but this means people who have trialed multiple treatments prior to reaching out to try potential novel treatments. But I just want to say that with an asterisk that we have hundreds of people on this session today, so I couldn't possibly explain the nuance of those referrals, but you can talk to your GP about referrals for those types of things. But I think that the key message I really want you to take from this is that it can take years to find the right treatment that works for us. And I highly recommend looking for clinicians who actually will explore different treatment options with you, because there are so many research and evidence-based treatments that are available to us that we might not have tried yet. So I'm sorry if that wasn't the best answer, but I also think using a service like Beyond Blue to unpack what you've done so far and then talk about what's left, what's next, might be a really great conversation to have. So get that expertise from a clinician to start unpacking what are the things I haven't tried yet. So referrals from any GP, somebody asked, are referrals free? I mean, any GP will typically have some type of gap payment unless they're bulk billing. But the actual referral to a particular service, and I think a lot of people forget this, if we do our own research and we find that there is a clinician or a type of counseling or service that we really want to receive, we can bring that name in to our GP and say, I want to explore this for myself. I think it might be helpful. And they can write out the referral there. But the service that they're referring you to can vary so vastly. There can be different amounts of gap payments or costs associated with the professional you've been referred to see. But I think that's actually a piece of advice that's really important to remember. So let's say you've seen somebody who's been absolutely brilliant for you. If you think that the person that you're supporting might actually benefit from the same thing because they've shared with you a similar experience, maybe you've trailblazed for them and you can give them that name and phone number to refer to. Yes, the recording will be available, to people who have registered. So if they did not register for this, they won't automatically receive the recording, but you are welcome to share the recording. For any of you that decide to share the recording of today's session within your organization, just be mindful that, for example, the Medicare allotment that we get from the government used to be 20 sessions, now it's 10. It went up during peak COVID times. So there can be changes and nuances of availability around these services. So just be aware that those things could change over time, just in case you put it on your intranet and it sits there for 5 years, things could change. So I really want to thank you all so much for coming to today's session and for the wonderful questions, the great feedback that we're seeing here in the chat. Please take your time today to take just 3 minutes to send us your feedback on today's session. We keep nuancing this presentation to make it more helpful for you, but I hope it's felt practical, it's felt engaging and warm. And I also just want to say, as you go back into your work day, your work week, the rest of the year, just being mindful to hold space for those of us that actually today could be really, really tough. Just to be mindful that we're actually not walking around just saying, are you okay? Are you okay? That's actually not the theme of today. The theme is holding space for each other, being open to the fact that many of us are going through things and carrying things that are heavy that we cannot see. And that mindfulness alone is important, but to notice changes in people's behavior, to be curious about those things, and to normalize how many of us are going to tip over time and again in life, and that you deserve support anytime it's helpful for you. So thank you so much for listening to today's session, and I hope you have a beautiful rest of the day. Thank you so much.